Hello, I'm Professor Mohamed Khadra and I'm pleased to present you this video on biopsies of the prostate. The aim of this video is to help you understand the operation, its main side effects, and to prepare you better for your upcoming procedure. This video is intended to be used in conjunction with the information leaflets you've been provided. This procedure involves using an ultrasound probe inserted via the back passage to scan the prostate. Biopsies are taken through the skin behind the testicles, what's called the perineum, using a special grid, or through the rectum itself. The sampling is targeted and the number of samples taken depends on the size of the prostate, usually ranging from a few to up to 50 samples. There are several reasons why you might be advised to have a prostate biopsy, including your PSA is high, your MRI scan shows a lesion in the prostate, or you may have already had some previous biopsies which are inconclusive, but your PSA is still rising. Make sure before the procedure to inform us of any blood thinning medications or conditions that may affect how we perform the procedure and how you heal after the procedure. A full general anesthetic is normally used and you'll be asleep throughout the procedure. If you have any allergies, be sure to let the anaesthetist know. You'll usually be admitted to hospital on the same day as your surgery. After you're asleep, your legs will be placed in special supports and we then examine the prostate through the back passage before inserting the ultrasound probe into the rectum. This probe is as wide as a man's thumb and approximately 4 inches long. In order to take samples or biopsies of the prostate, a special grid is used so that all areas of the prostate can be included. In the case of transperineal biopsies, the biopsy needles are inserted into the prostate through the skin of the perineum, guided by the ultrasound probe. After the biopsies have been done, a dressing will be applied to the perineum. In the case of rectal biopsies, the needles are inserted through the rectum into the prostate. The most common side effects have to do with blood in the urine for up to about 10 days, blood in the semen for about 6 weeks. This is harmless and poses no risk to you or your sexual partners, and bruising in the perineal area. Urinary infection poses about a 10% risk. Hemorrhage or bleeding preventing you from passing urine, which occurs in about 2% of patients. Occasionally, blood-borne infection needing hospitalization can occur. This is more common with rectal biopsies, but can occur with transperineal biopsies. Hospitalization due to bleeding is very rare. The failure to detect a significant cancer can occur, and the procedure may need to be repeated if the biopsies are inconclusive, especially if the PSA levels continue to rise. When you're discharged from hospital, please ring my rooms to get the results. It will normally take about 2 to 3 weeks to get those results. It is important that you sit quietly at home for the first 48 hours after the biopsies, drink more fluid than you normally would for the first 48 hours, and maintain regular bowel function. Try to avoid physically demanding activities and complete your 3 to 5 day course of antibiotics. If you experience a fever, shivering, or develop symptoms of cystitis, you should contact your GP, or if unavailable, our rooms or the hospital. If there's a lot of bleeding in the urine, then please make your way to the nearest emergency department. After any surgical procedure, there are known side effects. But if you're concerned or the side effect is unexpected, please don't hesitate to contact my rooms or present yourself to the nearest emergency department. Hopefully, this video has presented you with an overview of the procedure. You will have already received the patient information booklet, and we've had discussions during our consultations. If you have any questions about any of the contents of this video or the information sheets you've received, then please don't hesitate to contact the practice or to make another appointment before your operation.